got an ache inside of me. It's a deep hole where I bleed. Oh, can I seal it? You're like an ocean without land.
Hi guys, welcome back to my channel. So today's video, I'm finally going to start doing pregnancy updates again. Time is really just getting away from me and I keep forgetting like how far along I am. Today marks 26 weeks with baby boy number 3, which is just crazy. So I'm really, I'm just gonna jump right into it. But if you are new here, I have an entire playlist of all my pregnancy updates from last year with my last pregnancy, so I will link that down below and in the card so you guys can go watch those. I haven't gone back to watch them. Super cringe. Don't need to put myself through that. So I decided that this time I'm going to get a coffee once a week. Well, I do more than once a week, but I'm going to get a coffee once a week, sit in my car, and update you guys on my pregnancy because it's peaceful and it's quiet in here. And there aren't kids screaming and dogs running around. So, before I start, I just want to share with you guys my coffee. I got a grande iced pumpkin spice latte with only 1 shot of espresso because I am pregnant. And I also didn't know it came with 2, which makes sense why I'm like a jittery, anxious mess after I drink these. And then I also got nice water because I'm parched. So this is going to be my 25th week because I did just experience all of my 25th week and not my 26th week, if that makes sense. So I'm just gonna start off with a quick kind of run through of some of my favorite products because I feel like that's like the most fun. I've been obsessed with Jessica Alba's Honest Company line. She has the best body butter I've ever used, and I don't like the consistency of lotions on my skin and then like putting clothes on because I feel like it just sits on your skin. I've tried like the Arnold, is it Arnold's? I don't know, something like some sort of cocoa butter. Like I've used a ton of stuff, and this stuff, like the consistency of it, I don't know, you can't really tell. It probably looks like every other bump butter ever, but it just like, it seeps into your skin so fast. I don't know, I'm absolutely obsessed with this. I'm not sure how much it was. I will link it down below for you guys. And then I've also been obsessed with her body lotion. I love the packaging of this. I just think it's so sleek. It doesn't have a scent whatsoever, which I love because I'm really sensitive to smells, especially like fragrances and body perfumes and lotions. So I use this and this body butter like daily, especially now that I'm getting bigger. My stomach is starting to itch a little bit more because it's expanding so much, you know what I'm saying? So the next product that I want to show you guys is this Teami Greens. Now, if you've been following me for a while, I don't eat healthy in the slightest. I literally eat like a toddler, and I feel like crap throughout the day, like absolute crap. And also, my coffee today, I just realized when I was looking through their ingredient list that they put 2 shots of espresso in, which is why I get like super anxious and my anxiety is like through the roof. It's because I'm literally cracked out on caffeine. But I talked to my OB about this. She said it's amazing, like everything that's in it. It has 16 different superfoods in it. It's literally just a supplement. It's like taking a vitamin. I put 1 scoop of it in my smoothie a day or every other day. I'll usually have it because sometimes it just depends on what I'm craving. But it has matcha, it has wheatgrass in it, it has spinach. It's awesome. I also have a discount code for you guys if you want to use it, and I will put it in the link below. Also, you don't taste it, which is mainly why I use this because, like I said, I eat like a child and I have such a bad sweet tooth, especially when I'm pregnant. So again, I'll link that down below for you guys for 15% off your next purchase. And they also have things like protein powder, they have skincare, they have all sorts of stuff like blender bottles, so go check them out. So I have all of my symptoms written out on my phone, and I will say, compared to my last pregnancy, I feel extremely grateful because this pregnancy has not been that bad. I struggled a lot pain-wise last pregnancy. I was working and I was constantly on my feet, and I feel like I was pushing my body way too much, especially because my pregnancies have all been so close together. My body was just like, what the heck is going on, dude? So I have everything written on here. It looks like a lot, but it's not that bad. So 25 weeks. I'm just gonna start off with a bang. I am terrified to go into labor again. Like, so scared. I have trouble sleeping at night because I know what to expect. Usually they say this is like a first time mom kind of thing because, you know, you don't know what to expect, but because I do know what to expect, and because my second labor, my last pregnancy, was so hard and scary and painful. I labored naturally for 20 hours and I was in active labor for like, I don't know, 13 hours or something crazy like that, which means my contractions were literally back to back. I probably had like 10 seconds in between each contraction. It was just brutal. And then they gave me fentanyl and I hated it and I didn't want it, and it gave me an anxiety attack, and then the rest of my labor I was in like a panic attack. It was just not fun and I'm really scared. So these are the things that scare me going into labor. IVs scare me. I had a bad experience my first labor where they kept missing my vein and I ended up having like a huge bump on my arm just full of fluid because this girl missed my arm. So I'm terrified to get the IV. I hate needles. I have no pain tolerance whatsoever. Like, yes, I've given birth twice and I'll obviously keep doing it because it's so worth it, but I'm also really scared. So being in pain in general just gives me anxiety. I don't know why it does, especially I feel like right when I get into the hospital. Maybe it's just hospitals that like make it worse. I guess I just kind of associate hospitals with death, which sounds really bad, but like someone extremely close to me died when I was really young and I spent the majority of my like summer in the hospital with them. They had cancer, and you know, you're on like the floor where everyone has cancer and everyone's sick, and it was just kind of traumatic. So every time I go in there, I just have this awful feeling that something bad is going to happen, and it never gets better. So yeah, I'm afraid of hospitals. Being in pain gives me anxiety. Getting an epidural scares me, and I don't even need to get an epidural. Like, it's not mandatory, but I'm gonna get it because it's painful. So I mean, like, either way, I'm going to be experiencing pain, and I'm really just not ready for it. My fear of pain and the unknown, which that in of itself kind of just tops everything off. Like anything can happen when you're in labor, and it just scares me. Please don't let this scare you. I literally just have anxiety all the time. Like, I'm just a scared, anxious person, I guess. So yeah, but I hate this part because it kind of takes over the excitement of realizing like, hey, like, you're gonna meet your baby like within the hours. Like, I'm so scared and so focused in on this pain and like scared of what's going to happen, even though I know nothing bad is going to happen. It's just, it's a vicious cycle. I can't stand it. Okay, the next topic. I really want to get a new OB, and I know I'm really far along, so I don't know if I'm allowed to do this, but I don't want to deliver at my hospital again, especially with my last experience. Like, the OB unit, or not the OB, the delivery wing was just completely full. It was completely full, and they just didn't have any rooms available for me, so I was in triage for like 3 hours just waiting, and that really sucked because I was in a lot of pain, and that's when I knew like, this is not going to be a great time. Like, I already know this is gonna be a bad experience. And then my nurse was awful. She was like super young, didn't want to be there. She was like pissed off, I guess, like stressed. Totally understandable. Women in labor are not the nicest sometimes, but like, when I'm in pain, I just want to be comforted. And my first nurse with Landon was amazing. She was a sweetheart. She was just the best. And this nurse was not. She was just not happy, didn't want to be there, was never in my room, never talked to me, didn't even tell me she was giving me fentanyl. She was just like, I'm giving you medicine in your IV. So I don't want to deliver at that hospital again. I really want to deliver at another hospital in my area, which has a brand new labor and delivery unit, and it just looks really nice. I've heard amazing things about the doctors associated with that hospital. I just don't know if they're going to accept me as a new patient so late, and I'm nervous. Like, what if I don't like it? Like, what if I traded in something good for something worse? So I'm just a little bit stressed out in the area of delivering. And my doctor also, I don't have one specific doctor with my OB office. I rotate between doctors, and the doctor that delivered Darren, he is like 70 something years old, so he's out for COVID reasons. And then the doctor who delivered Landon, she ended up moving states, so I didn't have her last time. So I don't even see the same doctor. I don't know any of my doctors by their names, as bad as it sounds. I have so many new doctors, and I don't like that. I feel like it would be the same thing as a random doctor just coming in and delivering this baby, and I just don't like that feeling. I want to be close with my doctor. I want them to hear me out and listen to me, and I don't feel like that's happening. So that's the good stuff. A huge symptom though that I am experiencing is ocular migraines. I never experienced this before. I have a lot written down on here just so I don't miss anything. So I had a really big scare about a week before Kevin came home, and I was in the boys' room folding clothes, and my vision just started to go. It was as if I was like staring into a light bulb for like 10 minutes, and I looked around and everything was just like blurry and faded, and like it was super weird. And I was like, okay, like this is really strange. I have no idea what's going on. So I tried to get up. I immediately felt super lightheaded. There was a weird strain in my head. I got really scared, so I sat down with Landon and I tried to ask him a question, and just gibberish came out. Like I couldn't even speak. I started to freak out. I called my mom sobbing. I couldn't even get the words out, and I had been by myself with the kids for almost 3 months, 2.5 months by myself. So my mom was like, it's probably just like exhaustion. Someone else was saying it was probably a migraine. I never experienced anything like that again where I couldn't talk. But then 2 weeks ago, I have a migraine almost every single day. It's absolutely awful. It was so bad the first time I got it again that I went to the hospital, and they tried to give me IV medication, and they wanted to start me off with some type of anti-nausea medication, which ended up giving me a huge anxiety attack. And I asked them to take it out and like let me go home, because it was just, I didn't like being there, because with COVID and everything, you can't have anyone else in the room with you. So I was by myself in pain, and I was like, I'd rather just be in pain at home. But they were gonna give me magnesium. So when I saw my OB doctor next, I told her like they were gonna give me magnesium. She was like, yes, like you can take that over the counter. So I have them right here. I'm actually gonna take this pretty soon. I take one every single day. Stops my migraine like mid in its tracks. It's amazing. So I take these on a regular basis. I was afraid that these were migraines that were coming back, because I have I have a history of having severe headaches and migraines, especially growing up. They were awful. Like they would make me want to like throw up, like I'd be bedridden. And I was like, I hope these aren't coming back, because I was prescribed medication years ago and then they just never came back. So I was like, please don't let this happen again. But apparently later on in your pregnancy, like around your second trimester, there's a huge shift in hormones which can cause migraines. So apparently that's what's happening. So they recommended magnesium supplements, which I take once a day. And the next thing that's been happening to me is my eyesight is like awful. And I think it's just because of these migraines, and because apparently when you're pregnant, the thickness of your like retina or something can change, and it can cause like your vision to blur or vision loss or whatever. But as soon as your baby's born, it goes right away. So I'm really hoping that happens, because I was getting really nervous, and I was like, I think I'm going blind at the ripe age of 22. Next thing are Braxton Hicks, and every time I have one, I like realize like, holy crap, like I'm way farther along than I think that I am, because like I'm so busy with 2 kids, and now my husband's home from the Air Force. Like there's so much going on in my life right now that my pregnancy like isn't even on my mind. Like if I feel him move, I'll be like, oh, like I'm pregnant. You know, so it's just so weird. And I get them all the time now, which usually starts to happen towards the end of my pregnancy. I will get Braxton Hicks all the time, like the last couple of weeks, like just back to back. So I'm starting to experience them a lot more. My lower back is in extreme pain again. I've had this with my last 2 pregnancies, and it's just because I carry really low, so I can't like bend over and stretch. So I'll wake up every morning just in really, really bad back pain, and it sucks. And I can't wait to be able to lay on my stomach again because I'm a stomach sleeper. I need to take a sip of this. So I feel him in my ribs a lot. He's always moving. I do have a posterior placenta this time. I had an anterior placenta my last pregnancy. I can't talk now. So I do feel him quite a lot. I mean, I felt Darren move a lot, but I felt him move pretty early on, and I think it's just because it's my 3rd baby, and they say like the you know, later on after each pregnancy or whatever, you can feel them move a little bit earlier. I always feel him under my right rib cage. He's always fluttering under there, and he like caters to my right side more. Like I'll feel his whole body just on my right side, which is kind of funny, I guess. I don't think I really experienced a baby favoring a side. Also, we are between 2 names. We are between Hudson and Leo. I don't know if I should even be sharing this because last time the names that we were between, we didn't even end up choosing each. Okay, sorry, my camera cut out, but anyway, we ended up choosing 2 completely different names than what I had told everybody. So everyone was super confused when I was like, yeah, we named him Darren. They're like, that is not Luca. Like, where did that name come from? So we're between 2 names as of now, but we are gonna wait until we see him to name him. But I am rooting for the name Hudson, you guys. Like, I am obsessed. Kevin is coming around to it, but he likes the name Leo, but I just don't think it fits. Like, I don't really like it. I'm also experiencing SPD, which, let me just look up what that stands for because I can't remember. Okay, so I'm on my What to Expect When You're Expecting app, and literally common symptoms of 26 weeks literally say migraines and blurred vision. I've never experienced these before, and I'm kind of upset that I didn't know about this. But it says if your eyes are feeling irritated, that's probably because pregnancy hormones decrease tear production, which leads to dry eyes. Oh, it says to be sure to tell your practitioner if you develop serious vision problems, since this could be a sign of preeclampsia. What the heck? I need a new OB. Like, this lady does not seem concerned in the slightest. And then for migraines, it says some women who have a history of migraines have them more often when they're pregnant. Interesting. Okay. Oh my gosh. Now that I'm reading this, before I get to SPD, round ligament pain, I've been having a ton, which kind of, it's okay, so I'm just gonna explain what it says right here first. It says, if the growing pains caused by your expanding uterus, technically called round ligament pain, are feeling particularly achy lately, get off your feet, blah, blah, blah. Okay, just advice after that. It basically feels like there's a rubber band, like, on your stomach. So if I move too quick, it kind of just feels like a quick stretching. And I've been feeling that a ton, and I feel like it's because I'm picking up the boys often. But even when I try to get out of bed, like, I've been experiencing this way more, and I don't know if that's something that I should be worried about, but I just thought it was really odd. But I'm trying to find this SPD. Okay, it's symphysis pubis dysfunction, SPD. It's literally just pain on your pubic bone or around your pelvic area, and mine is like only on my right side, like on the inner part of my leg towards like my pelvic area, and it hurts so bad. It aches all the time, but I'm not gonna complain because last time it hurt everywhere. Every step I took, there was just shooting pain. I still have a long way to go, so it could get worse, but I'm really hoping it doesn't. I could do like pelvic stretches or something like that, but I will say though, my skin is always really nice when I'm pregnant, and my hair grows super fast. It's really shiny. Like, my skin is just, it's so nice when I'm pregnant. I love pregnancy skin. I love gaining weight when I'm pregnant because I'm very, very petite. So my arms are a little bit bigger, my legs, like everything is just a little bit bigger, which I like. I'm back on my BS with craving things that have no nutritional value, which basically means you crave things that aren't necessarily edible, if that makes sense. So I'm craving ice chewing again, and I'm craving the smell of laundry detergent, and also the smell of exhaust. It smells really pleasing to me. Excuse me. Mainly the chewing ice though. The chewing of the ice is really getting to me. I have about a cup a day and it literally wrecks my teeth, so I need to stop. But it's so good. And I know that that's like a sign of probably having an iron deficiency, but no one said anything my last 2 pregnancies. They said my iron levels were good. So I don't know, but I'm not complaining because it's so satisfying. Like, the satisfaction is real, and it's so weird because as soon as the baby's born, like literally snap of a finger, they're out, it's over with. I don't crave any of that stuff anymore. I don't crave literally anything I crave throughout my pregnancy. I don't crave. It's so strange. It's so weird. But those are like the things that I've been craving lately, are non-edible things. Alright, you guys, thank you so much for watching. If you enjoyed this video, make sure to give it a thumbs up. I will make sure to do weekly updates for you guys, but make sure you subscribe down below, and I will see you guys in my next video. Bye!